other family doctor, caring for your dogs, cats, and other family pets since 1985. WestsideVetJC.com.
KWOS Open Air brought to you by Arts Pest Control. You stay. They go 556-6397. Our number, John Marsh, Dick Aldrich, and our guests, podiatrists from JCMG, Dr. Bill Duke and Dr. Jody McAleer. Doctor, I know you want to talk to us about ankle joints and some replacement work that you guys are doing.
Yeah, so we've been providing, trying to provide our patients with the very best new cutting-edge procedures here in Jefferson City. Both Dr. Duke and myself trained at large institutions, myself out of New York City and Dr. Duke out of Chicago. So we're trying to bring some of these new technologies to the area, and we've been implementing total ankle joint replacements at our practice through St. Mary's Hospital as well for the local patients that have very bad ankle joint arthritis.
I think so many times when people hear about joint replacement, they obviously think about knees and hips, but falls right in your wheelhouse with the ankle, doesn't it?
Yeah, and it's a complex procedure, but patients do excellent with them, and it can give you a new lease on life as far as being able to get out there and do the things that you want to do.
Is this usually something from arthritis, or is it a previous injury, or what causes you to have your ankle replaced?
It's from both of those, actually. We've seen patients who have significant arthritis that is just kind of primary arthritis, and then some that have post-traumatic arthritis. Maybe somebody had an injury earlier in life to where they've developed somewhat of a deformity there, and now, again, like with the Lapiplasty, this ankle joint replacement allows them to get back to activities that were once pretty cumbersome and painful for them. So pain-free is the goal.
What kinds of materials are being used in those ankle replacements?
Typically, it's a chromium alloy, a trabecular metal, and then also there's a poly component, very similar to the synthetic and metal components that you see in knees, hips, shoulders, and so on and so forth. Same materials, just adapted for the particular joint that we're working on.
Talk to us a little bit about the whole arthritis side and rheumatoid arthritis side of your practice and all. I know I've talked to my family doctor once upon a time, say, hey, balls my feet, give me fits, a knee, and thing like that once in a while. And his comment was, knowing me as long as he did, was, played sports, didn't you? Yeah. Play any baseball? Yeah. What position you play? Catcher? And he just looked at me and went, there you go.
Yeah, you did it to yourself.
Exactly. For a lot of folks, and then when you get a little older, it haunts you, doesn't it, Doctor? You can relate.
It does. What they don't tell you when you're a kid is, hey, 30 years from now, something might hurt you a little bit, and you're going to have to buy some Advil or something. But it certainly does. The great thing about what we're doing with ankle joint replacements, including replacement of your big toe joint, too, it goes all the way down to there. And what you can do in knees and hips, we can do in your foot and ankle. That's the key thing for patients who really qualify for it and who are candidates for it. And, I kind of believe, I'm sure Dr. McAleer's on the same page, age isn't definitely something that knocks you out of contention, okay? It's your activity level, how healthy you are. So we have patients in their 80s who are benefiting from these procedures.
Talk to us about the whole orthotic side of it. So many of us had friends in sports and all who profited greatly from the use of orthotics and kept them on the playing field.
Yeah, orthotics can be used for things such as plantar fasciitis, which is very, very common. We see patients coming in with heel pain regularly, and if you provide the proper orthotic that's going to provide the proper control and support of the arch and maintain the foot in the right position while you're on the field being competitive, or even if you're just chasing after your children or your grandchildren, they can be very, very beneficial. Some of us are what's known as overpronators, where we have a collapsed arch and our foot will fall to a certain degree. Just because you have a flat foot doesn't mean you're going to necessarily have a problem, but that can in turn lead to the development of arthritis. It can lead to tendon problems, tendon tears, just from use and abuse, wear and tear over time. And the orthotic can help to slow that process or even stop it.
Well, and so many people, as you say, not just athletes, but just so many people who want to walk or who want to be active, and it's so important part of your practice to keep people on their feet and literally and keep them going.
Yeah, that's absolutely true. I tell my patients the human body was built for movement, and we lead very, very busy lifestyles. We're on the go constantly. the days of sitting down and having dinner for an hour with your family has kind of turned into the microwave for 4 or 5 minutes, and maybe once a week you get it. So our goal is to keep you as active as possible, as comfortable when you're active as possible, and to let you enjoy the things about life. That's it.
Drs. Duke and McAleer in with us, JCMD, podiatrist, talking to us, 556-6397. Can we talk a little bit more maybe about the whole sports medicine side of the practice?
Sure, absolutely.
This is a sports-crazy community. Dr. Duke especially can attest to that, your many hours on the sidelines and all. But, boy, that is a big, big part of podiatry, isn't it?
Oh, it absolutely is. You know, I get asked a lot, why podiatry? And one of the reasons is sports. You know, I was fortunate enough to play sports through college, and there's not too many sports that don't involve your foot or your ankle, right? So with sports, there's injuries. And, you know, Dr. McAleer and myself have a lot of experience dealing with sports, the sports medicine side of foot and ankle problems. And we're fortunate enough that we have the ability to get people back to playing sooner rather than later.
Well, you talked about plantar fasciitis, and boy, track athletes and people like that can relate to that, where back in the day, even at the high school level, that sidelined a kid for a season, wasn't it?
I'll tell you, I see so many young guys and gals coming into the office that play, that are running track, that develop Achilles tendonitis, plantar fasciitis, and mainly, especially in the youth population, something called calcaneal apophysitis, which is an inflammation of the growth plate in the heel bone. And you're talking about pain and something that'll slow you and stop you. I mean, it's pretty miserable for these young athletes. So we try to get them right back into the sport as quickly as possible while providing the best care that we can. And we're usually pretty successful in doing so.
You talk about tendonitis, and I hear tendonitis used all the time. What is tendonitis?
It's tendonitis is one of these terms that we kind of use with very broad strokes, but it tends to describe an inflammation of the collagen or the tendon tissue. And tendons basically are connection points between the muscle and the bone. So it's like a large fibrous strap that helps to hold things together, and it allows for the functional movement of your joints.
Doctor, the Achilles tendon, we hear it all the time in sports, and football and basketball players really seem to be prone to that. How has treatment changed over the years, and is it any less serious than it used to be?
I guess the seriousness kind of depends on your approach to it. I'll tell you, one thing that we are doing for people with Achilles tendonitis and even some small tears is something called PRP, injection therapy. It's where we can take some platelets out of your own blood and spin it down, kind of concentrate it, and inject it back into that area. And it's been very, very successful, and it allows people to get back to their activities again. That seems to be the constant theme, I know, but it's really helping a lot of people. So as we continue to advance in the things that we do, the goal is let's get you back to what you enjoy doing without having you sidelined for a long time.
Yeah, that PRP, that platelet-rich plasma treatment is fantastic.
Mm-hmm.
We've seen a lot of great improvement in patients, especially with Achilles tendonitis and plantar fasciitis. And it's a form of regenerative medicine, basically just using your body's natural healing ability to get you back on the field, get you back on your feet, and get you back to your lifestyle.
You're probably listening in the front office. We have a coworker who is a long-distance runner. He is a typical long-distance runner. Will injure himself and keep running and all. And I think there's a misconception sometimes with from the advent of the magazine runner's world, and all the high-tech shoes in the world aren't going to help you if you've got a pre-existing condition. And like long-distance runners, keep abusing it, right?
And their threshold for pain is amazing. The punishment these individuals put themselves through, I'm just scratched my head and I said, my hat off to you, because the
endorphins must outweigh the pain.
The runner's high. I mean, they just can run through almost anything, and sometimes to their detriment. So the main thing is to run smart and not to allow yourself to become permanently injured, where it's going to preclude you from being able to continue to participate.
Dr. Bill Duke, Dr. Joni McAleer, podiatrist from JCMG, talking about some neat procedures. Well, gentlemen, we appreciate it. Thanks for the update on the bunion procedures and the ankle joint replacement. Some real modern technology here in Jefferson
absolutely.
City.
Yeah, thank you for having us.
Thanks for having us.
Yeah, keep us up to date on the Lapiplasty, too. I know you guys have seminars from time to time on that, so keep us up to date, and we'll be happy to pass that along.
Yeah, we're potentially shooting on having one here in the next couple of months. So hopefully we'll have some information for you on that.
Okay, very good.
Very good. Coming up Monday, KWOS Open Air will have a visit with historian Dr. Gary Kramer from